So today we're going to talk about neck surgery, especially in athletes. And there's three different options. If you've got a herniated disc, which is putting pressure on a nerve that's causing pain, weakness, or numbness down the arm, or pressure on your spinal cord, the surgery basically goes in and just takes the pressure off the nerve of the spinal cord. And there's three basic options. There's a fusion, an artificial disc replacement, or a foraminotomy. And a fusion is the most standard. We've done about 40 in athletes. We reported 25 in professional athletes, and 80% of them returned to their professional sport after the surgery, and the average return is about 9 months. And so it's a good surgery, it works very well. The fusion works because when we do the surgery, we make more room for the nerve by opening up the disc space. We take the disc out, take the pressure off, and it stops the motion, which stops the problem from coming back at that level because there's no more motion, so it won't come back. The two bones fuse together. It's a great surgery, very successful, really gives the athlete the best chance of getting back to their sport and being able to play for another 3 to 5 years and finish making money in their career and do the sport they love. And it's the #1 surgery done all over the world for cervical issues because it's so reliable and it works and it treats the immediate problem. The downside to a fusion is it stops the motion at that level, so it can put more stress on the other levels, which can accelerate the wear and tear at the other levels, and you can develop problems at the other levels. And the incidence of that happening is around 20 to 30%. So it's not overwhelming, but it is a significant number. So one of the alternatives is an artificial disc replacement, where instead of the fusion device, we put in a prosthesis that preserves some motion, and it can put less stress on the other levels. Which is a very good surgery. We still open up the disc, we still directly take the pressure off the nerve and off the spinal cord, and it preserves the motion. The downside is by preserving the motion, there may still be some irritability of the nerve or the spinal cord, and the problem can grow back because there's still motion occurring. But the good thing about the artificial disc is if it doesn't work, we can just change it to a fusion with pretty low risk and low morbidity overall. Then the third option is go in the back and do a foraminotomy, which is a small incision. We use a microscope. We basically just make more room for the nerve. And that's a great surgery because it's minimally invasive. We're not putting any prosthesis or fusion in a person, so all your normal anatomy is still intact. The downside is we can only remove so much of the facet joint in the back to open up the hole because we have to save most of it because it's doing a job, it's providing stability. If we take out too much, well then you need a fusion because it's created instability. And so it's limited in how much it can open up the hole for the nerve. So it's good surgery, minimally invasive, but it doesn't treat the nerve as effectively as the fusion or potentially the artificial disc because you can't open up the hole completely. There was one report of a paper that showed about 45% of professional athletes that had a foraminotomy ended up having to have a second surgery. And I don't think the number is actually that high. It was just one study, but it does happen. And so the point is there's a plus and a minus and a risk and a benefit to all three options. There's always a risk with any surgery of nerve issues and risk of an anesthetic, but overall all three of those surgeries are very safe, very reproducible. They all have excellent outcomes. They all have about 80 to 90% success rate with the surgery. So they're all good options. And ideally, you want a surgeon who does all three and can really pick which one is best for you as an individual. And obviously consult and take your time to figure out which really one makes the most sense. But they're all good options, and they've helped a lot of athletes get back to their sport, and helped a lot of just normal everyday people get back to their life and have less pain.